Alright, good evening. COM103, last lab. This will be practice for the final. Final part 2 will be exactly similar. You'll add a doctor, patient, process some script, and then add a TPN. So if you log on to the lab, there's a file for you to download. COM103 final review doc. And it'll look like this. So here's the prescription. We'll add in the doctor. The doctor info is down here. We'll need to figure out the last digit, and then their office info is up here. For the patient info is here, very similar to quizzes and midterms. So we'll enter in them as the head of household as well. Diagnosis, allergies, and then 3 drugs. We'll just do the processing screens. And then down at the bottom is a TPN for us to add as an IV compound. All right, so let's get started. Go ahead and open up Visual SuperScript. And I'm going to add the doctor in first. So just like I learned in the labs, lab 1 was adding doctors. So let's add the doctor first, and then we'll add in the patient, process the script, and then we'll do the IVs. Okay, so I got the doctor info here at the bottom. So the name here, Dane Coolidge, PA. So that's going to be a physician's assistant. So MK already given to us. We just need to figure out the number. So go ahead and figure out the number. What do you guys come up with as the last digit? Add the first, third, and fifth digit. So that gives us 15. Then the second, fourth, and sixth digit. That gives us 20. 20 times 2 is 40. 40 plus 15 is 55. And the number in the ones digit is 5. So the last digit is 5. All right, so let's go and do brand new. All right, let's do new doctor. Last name first, so Coolidge, comma, space, and it is Dane. No contact. No, didn't give us any. So we'll enter in the address here for the medical center. Let me move this down a little bit. So they're at the Chula Vista office. That is at 500 Medical Center Court. And next line, I'll put in the suite number, STE 250, suite 250. Let's see if this number's in there. 91911. Oh, mine's in there. If yours is not in there, make sure you add it by pulling down the drop-down menu, selecting add, and entering it and saving it. All right, office and fax number. So we'll enter in as given, 4200. And then the fax number, make sure you go down to the fax field, 619-350-4208. Location quick code, don't forget your quick code. So Dr. Dane Coolidge, we'll do DK. No MPI given, that DE number was given, so we'll enter that in. So here it is again, MK176489, and we verified it. It was a 5. state numbers given. So they gave us a PA 92652. We'll put the same number here in the Medicaid. PA 176489.
CA would be the Medicaid?
Afterwards, PA. So enter in, yeah. So the California number, enter in PA 92652. Same with the Medicaid number. Oh, I entered the wrong number, didn't I? 92652. Yeah, I entered the wrong number. Alright, so this number should be state license and their Medicaid number. Alright, let's add the office. So it looks like Med 1 is the name, and then that's the address. So we'll add in the hospital. So right click to bring up the add field. So if you right click there, you can then do add new. Right, clinic name. So whatever's given there, we add Med 1. Clinic code, Med 1. Address, we'll put in that Chula Vista address, 500 Medical Center. Court, and that was Suite 250. 91911. And we'll enter in the office number, 619-350-4200. Alright, everything looks okay. Save, close, and there it is, Med 1. We'll just make them active, and that's it. So we're done with the doctor. You go ahead and print screen this and save, and we're done with doctor, so we can close them. Okay, the next thing we'll be adding is the patient info. So last name's given, you're just going to enter in your first name. Alright, so let's go to customer this time to bring up patients. Alright, so brand new patient. We're going to use Armstrong, comma, and then just use your first name. So it'll be Armstrong Dang. Enter in the birth date given, 11/27/1952. Quick code, just their initials, DA. Pay type, we'll make it cash. Private. Gender, select the gender you prefer. And then, yes, the patient's also going to be the head of household. Yep, so we'll add them. So, add head of household, yep. And then this is where we'll add in the address. So this address here, Brown Hill Place, 8471 Brown Hill Place. No apartment number. And let's see if the zip's in there already. 91915. Alright, mine's in there. If yours isn't, make sure you pull down the drop down menu and add as needed. Okay, home number is here, 619 4359030. No other office info. Alright, so this is the head household. Same as the patient. So you can print screen this one. And then once you're done, save it. And it'll be indicator right there. All right, let's see. No driver's license, nothing given. No social security. So since this is themselves, it's not specified. Pharmacy, they're at home. They're going to need easy caps for this based on the prescription. So the prescription says non-safety cap. So we'll give them all non-safety cap for this. Easy over there. Number of labels, 1 is fine. All right, so that's good. Let's go down to the allergies. So we got aspirin and hydrochlorothiazide. So try not to look under the abbreviation, but the actual drug name. So we need aspirin and then hydrochlorothiazide. So look up aspirin, click OK, and then look up hydro, H-Y-D-R-O-C, hydrochlorothiazide, HCTZ, hydrochlorothiazide. And then just make sure both of those show, aspirin and hydrochlorothiazide. Print screen, the allergy tab, and then we're going to go to the diseases. All right, let's see our diseases. So we got BPH, benign prostatic hyperplasia. So we'll look under prostate, the main body. We got hypertension. We'll just use any hypertension. And then we have intraocular pressure or increased ocular pressure, which is also known as glaucoma. So we'll look under the medical term. All right, diseases, click new, and then you'll need to right click to get the pick list. And then once the pick list pops up, we'll start punching in prostate, P-R-O. Whoops, where am I? P-R-O. And then scroll down. Prostate. There you go. Prostatic, P-R-O-S-T. So we have a couple prostatic. We have prostatic hyperplasia unspecified. So look under prostate, P-R-O-S-T-A-T-E. Hyperplasia unspecified. Benign prostatic hyperplasia. Yeah, that's the best one. Alright, so that's the first one. Next one is hypertension. So we'll click new.
That was BPH. Okay.
Yeah, BPH. Next one is hypertension. So, hyper T. So hypertolerance, hypertension. Anything that says hypertension is fine. And then lastly, glaucoma for IOP, increase ocular pressure. Right click to get your pick list, glaucoma. G-L-A-U-C-O-M-A, glaucoma. All right. So So just scroll up. That way all 3 diseases are pictured. And then you can print screen this guy and the patient's done. So just save them and you can close them. Okay, next thing we'll need to do, we added the doctor, we added the patient. Now we'll need to process the prescriptions. So we got 3 drugs. This one is non-safety cap, generic okay. This one, however, they want dispense as written. And then the last one, doesn't matter. We'll put safety caps on everything. Generic if we can, but this one seems to be brand. Refills are here. 1 here, none here, 11 there. And then, yep. That's it. All right, let's do the first one. So we'll go to fill RX. Where's my screen? There we go. All right, so that's the whole screen. So our first drug is going to be Lepressor 25. 1 tablet by mouth 3 times a day for 30 days, and then 1 refill. All right, so let's do new. Patient is Armstrong, ARM. So we'll look up the one we just added. I am Dang Armstrong. Don't worry about the HIPAA.
We're in drug here now?
We're in fill RX. RX processing. Coolidge was our PA. There he is, Dane Coolidge. Click OK. First drug, Lepressor 25. So LOP, enter, and we need the 25 milligrams. Oh, no Lepressor 25. So let's do generic. Do you guys know the generic for Lepressor? No. Metropolol. M-E-T-R. No, M-E-T. Met. There it is. So Metropolol. There you go. So METOPROLOL. Metoprolol. Tartrate, 25 milligrams. You do not want the succinate. The succinate is extended release. So Metropolol tartrate 25. Click OK. And then for this one, we can give generic. So the one that we have is generic here, so that's fine. Refills, 1 right here. Prescribed quantity, based on the SIG, we need to take 1 by mouth 3 times a day for 30 days. So they'll need 90. Oops, put it here, 90. So they'll need 90. METOP, metoprolol. So we're going to take 1 tablet by mouth 3 times a day. T1T space POTIDF30. Does that work? No. 3 times a day. 430. Does X30 work? No. F30? No, we'll just have to type it out. 430 days. $90 tablet should last them 30 as prescribed. Alright, so this one looks good. Give me a print screen before you save and record. Right. Alright, the next drug. Vicodin HP. So that's Vicodin high potency. 10 for 300. That's the updated strength. They want to have the brand. Dispense is written.
Is the checkbox the amount to dispense?
In the range. So you have to base, you have to QS it.
100 or 25 to 49?
Yeah, this one for which drug? Lopressor or Vicodin?
Well, we're on Vicodin now, so.
Yeah, so Vicodin is given here
25 to 49, and we got to figure out
based
how many to dispense.
based on the Roman numerals right there. So XLV, that's the amount to dispense, followed by the pound sign.
How about for Lopressor?
Lopressor, you had to figure out. You had to QS, so it's TID for 30 days. Doctor gave you a hint.
Sounds good.
It's between here. So yeah, the first one you figured out, you QS. This one, given to you. You're gonna have to figure out EDS. So we got Vicodin HP. Looks like it's gonna be 45 of them. XLV. And we're gonna do 1 tablet by mouth every 6 to 8 hours. Same patient. Same doctor. This time we want Vicodin, VICO. And there's the HP. Make sure it's 10 for 300. And this time they do want the brand. So make sure there's a B in this last column here for brand. So the one highlighted is already Vicodin, so we're good with that one. Prescribed quantity is 45 LXV. And the doctor said dispense as written. T1T space POQ 4-6H. Was that it? No, 6 to 8H. Every 6 to 8H. Q6-8H. Take 1 tablet by mouth every 6 to 8 hours. So based on the SIG, 45 divided by 4, it's going to be a little bit less. So 45 divided by 4, so EDS should only be 11. So 45 divided by 4 a day, EDS is 11. Alright, so make sure you change that guy to 11 so they don't get a rejection if they try to. No, C2. If I get in C2, he can't get a refill anymore. So at least by day 12 they can get another script filled. Alright, so double check your entry for Vicodin HP, 45 tablets, T1T POQ 6 to 8H, 11-day EDS. Save and record. Alright, one more drug on this prescription. So it's going to be INH, isoanize. So that's just the abbreviation. And it's 1 tablet by mouth every day for 30 days. Isoanize 311 refills. And doesn't look to be scheduled or anything. Okay. Not too bad. Alright, so let's do new. Same patient. sure you select Dang, saying doctor, INH, no, INS, I think it's INS, INS, no, let's look it up. How do you spell that drug? ISONIAZID. 300. Asanize, just generic available, so that's fine. ISONIAZID. Alright, let's see here. 11 refills and 1 a day for 30 days, so that's 30 every day. So refill is going to be 11. Whoops. Refill is there you go. Refill is 11. Prescribed quantity is 30. T1TPOQD for 30 days. Alright, so that one's done. So save, print screen, save, and record. Alright, so we're done with the prescription portion. So the next thing we'll need to add is the IV. Oops. Okay, so we're done with this guy. We can close him. We're going to go to drugs next. Alright, so we got to add this IV here. So it's a TPN. It calls for dextrose 15%, amino acid 2.5%, lipid 3%, and a total volume of 3,000 mLs. To run IV at a rate of 100 mLs per hour. So that's pretty much your order. You pick the supplies you want. So we got solution, we got our order, we got supply, and the mLs, right? The quantity we're going to add. So we need some amount of dextrose, some amount of amino acid, some amount of lipids, and we're going to QF with sterile water for injection. So just like yesterday's DC. So the order for dextrose is 15%, amino acid 2.5%, lipid is 3%, and of course water, we're going to QS. Supply, pick the supply that you're familiar with, or the ones you know we have in stock. So I know we have 70, amino acid I know we have 10, lipid I know we have 20, and then of course water is just water. And then our final volume for this guy is 3,000. So the math, order over supply times the final amount. Except for water, we'll QS. So let's do the dextrose. Order is 15, supply is 70, final amount is 3,000. 15 divided by 70 times 3,000. So that's going to be about 643. Right, we'll do the same for amino acid. 2.5 divided by 10 times 3,000. That's 750. And then lastly, lipids, 3 divided by 20 times 3,000, 450.
Sorry.
All right, and the last thing we need to figure out is water. So just figure out how much water you need to make the difference. So I'll add them all up and subtract. So we got 643 plus 750 plus 450. So that was 1843. So just subtract that from 3,000. So I got 1157. All right. So now that I got my information I need, I can now add it. Okay. So this is our label info, which is also going to give us all of our default information. So we're in the drug tab, and just do new. And the label name goes right here to the right. So D15 slash AA 2.5 slash AA 2.5 slash L3 3 liter IV at 100 ml per hour. All right, so I was able to get all of it to fit. So I just changed the 3,000 to 3 liters, and then everything was able to fit. D15, AA 2.5, L3, 3 liter IV at 100. So this one is just a TPN. So I'll just put TPN. Alright, drug class, RX, item type, compound. That way we have our ingredient generic, default SIG, infuse IV at 100 mLs per hour. Dosage form, it's an IV. Strength, leave it blank, it's multiple strengths. And then for our defaults, we'll put ml there and ml there. Package size, 3,000, because that's our final volume here. So we'll enter in 3,000 there. There you go. And then just a 1 day. All right, double check your default info. So you got the label name, quick code, everything looks good. Infuse IV at 100, ml IV 3,000. All right, go ahead and save it. And now let's go to the ingredient tab. So we got 4 ingredients to add: dextrose, amino acid, lipids, and sterile water. So let's add in our first item. Dextrose 70 is what we're looking for. So type in DEX, probably a T in there. Mostly, almost all to the bottom. So as long as it's dextrose 70%, you're good, because the quantity we're using is 643. So 70%, put in the quantity 643. Oops. There we go. All right, that's the first ingredient. Second ingredient is amino acid. You got to find it under the brand name. So I think there was aminosin, A-M-I-N-O. There you go. So there's aminosin 10%. It comes 15 and 3.5, so make sure you get the 10%. All right, aminosin, 10%. And then we want 750 mLs of it. All right, so we got those 2 ingredients in, dextrose, aminosin. Next is the lipids. I think the name was liposin, nice and easy. There you go, liposin 20, get the 20%. And then the quantity we're using here is 450. All right, so we got dextrose 70, aminosin 10, liposin 20. Lastly is water. think we looked under sterile, S-T-E-R. There you go. Sterile water for injection. And then make sure it is IV and not irrigation. And the quantity we're using is 1157. And that's it. We are done with this. So once you have your default label name and the 4 ingredients and the correct volumes, you're done. Just print screen that, and you are done with the lab final practice.